Hi, cameras. You can spend your entire nursing career back home without encountering cameras in patient care settings. If you plan to transition your practice to developed countries, you have to realize that that is not the case. You have to put at the back of your mind or train your consciousness to know that at all times someone is watching you. Eyes are watching you. These eyes may be cameras planted by the hospital, or cameras planted by the patient themselves. They may hide cameras in their room, or patient family may hide cameras in patient's room, maybe because they are suspicious of the staff. Maybe they think the staff are maltreating their patients, or they have an agenda. They want to get data or evidence to against the hospital or the staff so that they can sue and get money from that. So whatever their reason may be, just realize that it's a reality. It's scary and it's unnerving, but it is a reality. Now, there are a few reasons why hospitals and facilities use cameras. One of such reason is security. They place cameras in entrances and exits, and public areas like car parks, for the sake of security. Another reason why they do it is for patient safety. There are some patients that needs to be watched all the time. For example, if the patient is suicidal, they need to watch the person all the time. Sometimes they have a sitter actually in the patient's room. Other times they have what they call a virtual sitter. So it's a remote camera that is watching the patient. Another reason is if the patient is confused, maybe trying to pull on tubes or messing with the machines and the gadgets that are used to preserve their lives. So such patients are watched, and then whoever is caring for the patient is alerted if the patient is doing anything like that. Another set of patients that are watched are patients that are a fall risk. So again, the nurse or whoever is taking care of the patient is alerted. Or patients who are prone to seizures are also watched. So that's it for patient safety. Another reason is quality of care. They want to observe the interactions between the healthcare providers and the patients and make sure everybody is adhering to the protocols of the hospitals. So remote patient monitoring is also another reason. It may be in-house, that's it may be in the hospital, or it may be remote, maybe like virtual nurses watching patients, through the cameras. So there are federal laws as well as state laws that guide all these things, so that to protect the patient's health information. Some of the cameras are placed in strategic places. You can find them in medication rooms, corridors, nursing station, elevators, storage room. If they are placing a camera in a patient's room, they should of course obtain consent from that patient, and the reason why the camera is placed in there should also be known to the patient. Some of the cameras have audio, some do not. All those things are guided by laws. So just bear in mind that develop the consciousness rather that someone is watching whatever you are doing, and try to do what you should do per time. Thanks for listening. Make sure to like, share, subscribe, and follow for more.